The decision whether to live in the bush or the city comes with a lot of considerations, including cost and lifestyle. Now, a new report from the Australian Institute of Family Studies looks at the impact of location on children's well-being. The study, Families in Regional, Rural and Remote Australia, is based on 5,000 8 to 9-year-olds across the country. And it found that living in cities or regional areas makes little difference to a child's social and emotional health, but it does matter when it comes to physical development and education. Professor Alan Hayes is the director of the Australian Institute of Family Studies. When it comes to education outcomes, he says the lack of facilities can be a deciding factor for country kids.
I think part of the story is lack of access, and I think part of the story is around the differences in the aspirations and expectations of parents, depending on whether they're in the major cities or whether they're in the outer regional areas.
So you're saying that some of the difference is attributed to how much effort and support parents put in, so that's irrespective of where they live?
I think that's an important factor in children's educational outcomes, is what their parents expect, and that in turn reflects the sorts of backgrounds, values, attitudes, aspirations of parents. But I think opportunity is an important element too, and access to things like extracurricular opportunities for art, music, those sorts of things that children enjoy to a greater extent in the major cities as opposed to those who are living in regional Australia.
Onto the physical development side now. It is surprising that city kids are doing better on this than their bush counterparts, even though country girls and boys seem to spend longer outside, presumably more active.
What we actually found was that children in the major cities and in the outer regional areas, they were doing well in terms of physical development. It's the children in the inner regional areas, the children living in those areas around the major cities, who seem to be doing slightly less well in terms of physical development.
And why is that?
We did find that there tends to be an older population living in the inner regional areas, and perhaps the facilities and supports for older people are more developed than the supports for children and youth.
So for the purposes of this study, you looked at 8 to 9-year-olds across Australia. Why did you pick that particular age group rather than going younger or older?
We looked at that age group because it's part of a longitudinal study, and it was a first look to see at what was happening to the 8 and 9-year-olds, given that they've had some time to develop in their sight, whether they're in the city or the regions, and also because we had very rich data around parents' reports of their physical development, for example, as well as their learning outcomes that we could look at, given that they've been in school for 3 or 4 years.
Professor Alan Hayes, thank you.
My pleasure.